Assalamu alaikum. My name is Dr.Nauman. I am from the DPT second semester. Today the topic of my presentation is lumbar spine. So starting with the lumbar spine, what is the content of my presentation is, the first one is osteology, the second one is articulation, the third one is ligament, the fourth one is muscles, and the fifth one is blood supply, sixth one will be the nerve supply. So starting with the osteology of lumbar spine is 33rd of the vertebra. Lumbar spine is present on the third of the lumbar of the vertebra, and the intervertebral disc is 23rd of the intervertebral disc. So the osteology of lumbar spine is 33rd of vertebra and present on the 23rd of intervertebral disc. So moving towards the body region, the first four lumbar L1, L4, L from the L1 to the L4 vertebrae are similar in nature. The fifth one has some structural adaptation for articulation with the sacrum. Body. Transverse diameter is greater than the anterior diameter and the height. The size and shape reflects the need to support great compression load caused by body weight, ground reaction forces, and muscles contraction. So the lumbar spine, the transverse diameter of lumbar spine is greater than the anterior diameter in height. The size and shape reflects the need to support great compression. The lumbar spine size and the lumbar spine shape is according to the great support to the body with a compressive load caused by body weight, ground action forces, and muscles contraction. So the lumbar spine base, the lumbar spine shape and size is according to the weight, is according to the person bears some compressive load or some jerk movement. So the lumbar spine support all the body. Moving towards the articulation, inter-body joint, capable of translations and tilts in all directions. The first joint that is present in the lumbar spine is inter-body joint, capable of translation and tilts in all directions. Zygofacial articulation. True synovial joint, fibro-adipose meniscoid. So the zygofacial articulation is the true joint with true synovial joint. Fibro-adipose tissues and meniscoid are present in between the articulation. Third one is lumbosacral articulation. Fifth, lumbar vertebra and first sacral segment. So lumbosacral articulation is preparing up to the L5 and S1. First sacral ligament is inclined slightly anteriorly and inferiorly, form an angle with a horizontal angle called as lumbosacral angle. Now moving towards the ligaments. What are the ligaments present in the lumbar spine? Supraspinous ligament. The first ligament that is present in the lumbar spine is supraspinous ligament. That is well developed only in the upper region. Most common termination site is L4. The termination site of supraspinous ligaments is L4. May terminates at L3. That is starting from the L3, may terminates to the L4, but the most common termination site is L4. Intertransverse ligament. The second ligament that is present in the lumbar spine is intertransverse ligament. No two ligaments in lumbar area and are replaced by the iliolumbar ligament L4. There is also one ligament present in the L4, which is replaced by the intratransverse ligament, because intratransverse ligament is not a true ligament in lumbar area. Intraspinous ligament. The third ligament that is present is intraspinous ligament. Has least overall stiffness and joint capsule the highest one. So intraspinous ligament has overall stiffness and all joint maximum height of between all joints. The fourth one ligament is present is longitudinal ligaments. Longitudinal ligaments, there are two types. They are different on the location. One is present anteriorly, one is present posteriorly. So the anterior longitudinal ligament is strong, well developed in this region. So whenever you hear the word anterior ligament, longitudinal ligament, so you have to think that it is a strong and well developed in this area. The second one is posterior longitudinal ligament. It is a thin ribbon in lumbar area ligamentum flam is thickened here. As compared to anterior ligament, anterior ligament is strong and well developed in this region. I mean, it is covering most of the longitudinal ligaments part, interiorly most longitudinal ligament part, but posterior is thin nibbon in lumbar region. Okay, so whenever I show you slides, there is a presence of ligamentum flam where the posteriorly longitudinal ligament is seen clearly. So third one is iliolumbar ligament. Iliolumbar ligament, there are three bands present. The one is a ventral or anterior, dorsal or posterior, and third one is sacral. So posterior longitudinal ligament. After that, there is a band present ligamentum flam where it is very thick, very thin, and the posterior longitudinal ligament is thin. What are the muscles present in lumbar spine? Muscles of lower spine and regions serve roles of producing and controlling movement of trunk. As you know, the lumbar region is the most compressed, heavy load region of the body that maintain the balance. Mostly balance, sport, all the things, those jerk movements can be handled lumbar area. So the producing and controlling movement of trunk. So the lumbar region muscles are controlling the movement of producing and controlling the movement of trunk. Assist in attenuating sensitive force that affect this area. Many forces are come on and acting on this lumbar area. So the muscles are they are responsible for the all the sensitive forces. The first muscle that is present is posterior muscles. The posterior muscles of lumbar spines are three areas: superficial, intermediate, and deep. One is thoracolumbar fascia. Second is called erector spina. Third is called multifidus. That is all about the posterior muscles. Now moving towards the lateral muscles. There is only one muscle present in laterally, that is quadratus lumborum. Now moving towards the anterior muscles. That's all the name which are showing. The detail will be easily can be seen in the picture. I was not really bright enough to show you that, but in the picture it is very shown clearly what are the erector spinous, what are the multifidus, thoracolumbar fascia, so can be seen easily and can be defined easily with the in words. What are the muscles present in anterior muscles? One is called rectus abdominis, second is called abdominis wall, third is called psoas major. These three are the most important muscles. As you know that the interior part is very well strong and very well developed in upper region. So now, moving towards the blood supply and nerve supply. The blood supply is the four paired lumbar arteries that arise directly from the posterior aspect of aorta. Venous system is less draining internal and external venous system into the inferior vena cava. So the four paired lumbar arteries are there that provide directly blood to the posterior aspect of aorta. There are four paired lumbar arteries that are rising from the aorta and giving blood to the lumbar region, passing from the lumbar region, giving blood to the lumbar. Venous system is draining internal and external venous system into the inferior vena cava. Second one is nerve supply. Nerve supply is major sensory nerve is known as sinovertebral nerve, and there are some innervates present. So the major nerve supply is done from the sinovertebral nerve. Now the kinetics. Movement available, flexion. With the lumbar flexion we can do the flexion. That's the flexion position. Extension. That is the extension position. Lateral flexion. Rotation. Gliding. Tilt. Distraction and compression. These all are the movement present. That is all the movement performed on the lumbar spine. So there's one info box for you. This lumbar range of motion. That how much lumbar range exists in flexion. 50 degree. A lumbar spine can flex 15%. Extension. Axial rotation 5 degree. Lateral flexion 20 degree. These all are the range of motions of lumbar spine. When we are performing a kinetics on lumbar spine region, when we are doing flexion, When we are doing extension, there is a range of motion between that. So this is a range of motion that flexion is only 50 degree, extension is only 15 degree, axial rotation is 5 degree, lateral flexion is 20 degree. So that's all from the lumbar spine. If you have any question, you can put it in the comment box. I will inshallah answer all the questions.